Hi everyone. Welcome to another one of our super curricular talks. So today we have Mariella, who is about to start at Oxford, who is going to give us a lovely talk on how we're going to be using AI and starting to introduce AI into lots of different parts of the NHS and kind of journey from cradle to grave. So hopefully this should be really interesting. Lots of opportunities to kind of think about interview-based questions, MMI-based things. So really, really important to start kind of thinking about how you're going to reflect on these different aspects in correlation to things like work experience, volunteering, and everything like that. So since we already have quite a few people, did we get started?
Sure.
Amazing.
Okay, perfect. So it's lovely to have you all here with me today. As Akshita mentioned, I'm Mariella, and today I'll just be taking you through the cradle to grave journey. So that encompasses like the whole journey of life, in using AI in medicine to optimize the NHS. So let's have a look first at this talk. So, what we'll really be learning today, I hope to be able to break down AI in an accessible way, look at some examples of how it's involved in every stage of life, and discuss the system-wide impacts on the NHS itself. Towards the end of my talk, we'll link this to your MMI interview preparation and how you can use these ideas in your interviews to eloquently give the impression that you know a lot about this topic. I'd love for this talk to be as interactive as possible. So if you have any questions or comments, please do raise your hand or post these in the chat, and I'll try and get back to you as soon as possible. And especially later on when we're looking at specific MMI scenarios, I'd love to get some feedback and input. So just be prepared for that. Um, so first, I think it's good if we define what we actually mean by AI in medicine, because sometimes it can come across as quite a daunting or nebulous topic where you don't really know specifically what's being referred to. It's important to remember that we definitely don't mean robots performing solo surgeries or replacing doctors and taking over the NHS. AI refers to data-driven algorithms that are trained to recognize patterns which they can then help in clinical decision making, whether that's about who needs care first, who's at higher risk of disease, or how we allocate limited NHS resources. It's important to understand that it's the collaboration of AI and humans that is what will lead to the best healthcare system possible, rather than one replacing or outweighing the other. For example, AI could be used to triage patients based on clinical priority and optimize schedules, which would be really helpful for GPs because they'd be able to see the most high-risk, vulnerable patients first, whilst balancing the other cases to ensure that nobody's waiting too long to see a doctor. It could also be used, as it was in the COVID-19 pandemic, which you might remember, to predict disease risk and spread of outbreaks with these exponential models, as is shown on the screen. Another interesting aspect of AI could be used to model surgical scenarios, which would not only help educate surgeons on how to hone their skills and sort of map out a surgery before it's actually done without the high stakes risk of a patient's life, but it could also be used to convey to a patient how their surgery will go, which is very good in ensuring they have the maximum capacity possible of understanding what procedure they will be undergoing. So if we're thinking about this timeline of cradle to grave, the first place we'd naturally go is to cradle, which is the antenatal and prenatal and the early life interventions that AI could play a part of. Even before birth, it could help. So it could flag pregnancies as higher risk or lower risk of complications, using using patterns from scans and health records, which would allow midwives and obstetricians and all parts of the multidisciplinary team to tailor care plans early on. This not only improves the ability for professionals to mitigate potential future dangers to the fetus, but also to assist the mother. For example, if AI is used to analyze ultrasound images, this not only is good because it would free up radiologists' time to look at other cases that they're needing to analyze, but it also promises to reduce the number of emergencies and C-sections that have to be carried out on an emergency basis, which can be very stressful for soon-to-be parents and patients. So as soon as a baby is born, AI could also be used to interpret screening results, check and confirm diagnosis of rare and unexpected conditions. And in the event of extremely premature births, which often come with quite high complication risk, AI could be used to map out and analyze certain scans to determine, if present, the extent of these complications to form a personalized plan for treatment. Early diagnosis can genuinely change the trajectory of a child's life. So if AI could assist in doing so for lots of different births, that would really help the NHS in preventative care. And preventative care is going to be a theme of what you see throughout this talk. So then moving on to in childhood public health education, we're really thinking about schools and how they're going to help children make sure they're well educated about their own health and the health of others and the healthcare system. So AI could help in this by assisting public health teams, perhaps making campaigns, but also to analyze socioeconomic factors such as genetic and, well, socioeconomic factors and other factors such as genetic to give an idea of who might be most at risk of certain diseases or struggles such as mental health problems or obesity, which children and which areas and which schools might need a bit more support and monitoring there. This enables early preventative support, which again, it's so important for the NHS because if people don't get to the point where they're really needing help later on, this is so much better in terms of resource management and really looking after a finite budget as well, if diseases are mitigated before they become a real problem. And then if we're moving along our timeline and we're talking about adolescence and adulthood, we're thinking about ongoing care of patients growing up and beyond. I think some of you might have used or seen or know about even the online NHS symptom checkers. These are AI-based tools actually that guide patients on their next steps and what to do. So for example, you could say, I've had a headache for 3 days, and the algorithm might suggest that you take some preventative or over-the-counter medication for this. Whereas if you said, I've had a headache for 3 months, it might escalate this and flag it as something more high risk that you need to go and book an appointment with your GP about. So as mentioned before, this would really help GPs in sorting out routine versus urgent cases rather than this becoming the job of a registrar or someone who honestly has time that could be better dedicated to other things, which will manage caseload and waiting times. Also, for patients with chronic or persistent illnesses such as diabetes, asthma, or epilepsy, AI can predict when someone might have a worsening of symptoms or a flare-up, such as asthmatics feeling worse in hay fever season, which would reduce the emergency admissions by making sure people get the necessary medications when it matters. This improves quality of life and reduces strain on services, clearly, and also by providing patients with wearable devices such as insulin pumps for diabetes, could also use AI to naturally adjust insulin levels to help maintain homeostasis when it comes to blood glucose levels, which would prevent hypos or hyperglycemic incidences, which often would affect diabetic patients a lot more than if they just had this wearable pump. However, one thing I do want to flag here is that you've got to be really, really careful when talking about AI in regards to really mental health chat-based support. So don't say it's necessarily good in this regard because recently in the papers you might have seen, you might not, but the NHS have been warning against people using chat-based therapy support and instead, going to a licensed therapist. And whilst you could do both in congruence, it's quite difficult to monitor one or the other. So for people using it instead of that, we've got to ward against, which is why the NHS have basically said, if you feel like you need mental health support, go to a licensed therapist rather than turning to AI and ChatGPT and things like that, because, people are trained for a reason. And then yeah, I think management of long-term conditions is really where in adulthood it becomes most important because people don't have one specific illness. A lot of the time, it's more an ongoing symptomatic event that needs monitoring. Now, before we move to palliative care and thinking about older age patients, I think it's important to consider the NHS system-wide impact. So not only how it affects patients, but also how it can help NHS management. So one of the biggest NHS challenges, as I'm sure you'll be aware of through your, keeping up to the news and also preparing for your interviews, is appropriate staffing and workforce planning. This takes the role of AI as something that just benefits patients to something much greater, turning it into something that can help NHS managers, by example, helping them plan rotas better, avoid unsafe staffing levels, for example, in strike seasons, and reduce admin overload that just burns out our healthcare workers. So this consequently not only cares for the NHS people better, but also the patients, which altogether would maximize the satisfaction across the service much more. Similarly, AI can forecast spikes in A&E attendance based on weather, seasons, or events, looking at past data. So more staff or less staff can be scheduled to be in advance of tricky seasons, such as maybe a heat wave or flu season. So beds can be managed better and freed up to a wider range of patients. So we don't get the whole, oh, there's patients being treated sitting down in corridors that's all too well documented. And the healthcare system just hasn't really worked out a way of adapting to. And I think AI would be very good in mitigating this in future circumstances. The third huge struggle that we might think about when we're talking about NHS struggles is stretching out the finite resources and money that they have as far as possible when, quite frankly, there isn't enough. So behind the scenes, AI is very useful in this because it tracks hospitals' usage of certain equipment and certain medications to ensure that nobody over orders or under orders, which will also contribute to the sustainability goals of the NHS by reducing wastage. So it can even help manage ambulance routes based on traffic and adapting for better response time. So there's so many system-wide impacts that AI could have and does have that we really need to build upon, I think, which would be really interesting to look into and talk about in your MMIs to show that you have a idea of not only the impacts that it has on patients, but also staff members and just everyone in the NHS as a team. Now we can move on to thinking about later life, elderly and palliative care. So this is quite a sensitive area of healthcare, obviously, because it involves the grave side of the cradle to grave journey. So for older adults, AI could identify who's more risk at falls or who might soon need some extra support, such as home visits or live-in carers. Preventing a fall could mean avoiding a long hospital stay and preserving an elderly patient's independence, which will massively boost the quality of life and longevity of life itself, because falls and hospital admissions for elderly patients can make the difference between life and death. In the event of an elderly patient or person requiring medical support, AI could create care plans which consider the whole individual holistically, which is really important for looking after someone, not only healthcare, but socially, by combining that data to make sure that a wide range of healthcare teams have access to this patient's data. For example, a patient with a high risk of developing chronic dementia. This could mean flagging small changes in behavior. Perhaps they're forgetting more one day, forgetting less some days, and sort of monitoring this and feeding back to a healthcare team, ensuring that they can adapt a patient's healthcare plan or review it every once in a while to make sure that every patient is getting the best care possible, which is the purpose of the NHS. One of the most sensitive uses of AI, like I mentioned, is in the end of life scenario in palliative care. So predictive tools could gently help clinicians decide when it might be good to suggest palliative medications are brought into use, which would lead to more compassionate care in someone's last moments of life. It could also take into account previously expressed preferences of a patient or their family regarding sensitive issues such as resuscitation plans, so that that's not something that's brought up at these last moments of life, and it can be more about the patient rather than, their wishes getting it all pinned down at that last moment. This also helps families and friends of a patient feel knowledgeable when they know what's going to happen regarding the progression of one's life. So, yeah, I think in palliative care, all these things really they can be managed so much better than they are currently. And AI is really good in like in combination with what we've got already in flagging out which patients are most and least at need of this support. But I would also like to talk about AI as something that's not only positive, but also some things to be aware of when we're talking about ethical limitations. Because in your MMIs, it will be very important to know where AI's capability stops. These tools do assist, but they don't replace a doctor's empathy, experience, or holistic decision making. Also, as has been mentioned in a previous talk, whether you've been or not, I don't know, so I'll quickly flag it. Poor data could lead to bias and poor outcomes. For example, in the news a few days ago, there was a story about how thousands of patients were put at risk by incorrectly calibrated pieces of equipment, and people were led to incorrectly being diagnosed with type 2 diabetes and put on unnecessary medications, which not only can interfere with patient quality of life, but also really affects the number of resources being put out there to the people who really need them, who genuinely do have conditions such as type 2 diabetes. So this also means that waiting times are now lengthened to accommodate retests for the patients tested with these faulty machines. So AI can have disastrous consequences when not really kept tight limitations on. And I think it's really good to know that you need to keep an idea of these limitations and express that in your MMIs. So now that we've done that timeline, and I hope I've made you a bit more aware of what AI means in a clinical setting, I think we can talk about how they might crop up in your interviews. So we've got an MMI practice scenario of someone being used. Sorry, I can just see things going on in the chat, but I'll leave that for now. I will get back to it if your questions haven't been answered. So I think here's our first MMI practice scenario. And remember, if you've got anything to say, this is the time when I will be checking the chat, and I'd love for your hands to be up or maybe turn on your microphones and get involved. So yeah, this is the time to do that. Here's our first practice scenario where you're the manager of clinical finances on a hospital team. You're asked whether an AI system should be implemented to automate how patient referrals are prioritized. What are the pros and cons to consider when making this decision? And I'll give you a few minutes. I'll have a look at the chat on my other device so I can see what you're saying. I'm assuming you're typing in the chat now, so I'll just give you some time to do that and have a think.
If anyone would like to unmute and kind of share their answers as well. So if you put your hand up and kind of explain your answer out loud, that would be really good practice for your interviews in the sense that obviously when you get given a question, you're not always going to have time to prepare for it. So answering on the spot, making up kind of a logical line of reasoning with lots of different points is going to be really important skill. So if anyone wants to have a quick practice at that now and get some feedback, that would be really, really beneficial to your preparation, guys. But also some really good answers in the chat. So just kind of compile those ideas and pop your hands up if you are feeling brave.
I can also see the answers in chat and they're really good. So again, I can really tell that you've been paying attention to my talk, which makes me very happy because I can see you're talking about, prioritization of those with the most severe and urgent conditions and reducing waiting times and looking after the staff. Priority definitely, and scheduling, reducing stress on NHS staff, very good. And also some cons. Thank you for mentioning those. Data being misinterpreted, that's certainly a big one. Data bias, certainly. Just having a look through now. Yeah, the AI model could certainly be prejudiced towards certain groups based on previously existing models. That's a really good point. Thank you so much for sharing. I'm loving all this contribution. Thank you so much. Contradicting and distracting a physician from their own experienced decision. That's a really good one. I hadn't thought of that. So thank you so much. Prejudice data, certainly. Miscalculations. More regulation, definitely. And that's something that I think we'll go through. May miss rare conditions that don't fit the normal distribution. Yeah. So obviously in healthcare, you've got that saying when you hear hoofbeats, think a horse, not zebras. And that is certainly what the AI will be trained to do. So in circumstances where it is a zebra or a more rare condition, it would be really good for a clinician to be involved where they have a certain level of judgment and don't generalize certain cases. Data leaks, yes, that's definitely something that's really good. Automating some cases, yeah, some referrals may require human judgment. Typical males, yeah, definitely. That's a really good thing, like gender bias as well as socioeconomic bias and genetic bias. I think that's certainly something to think about. How much the human staff? Yeah, definitely. So AI missing things, I can see that's a big concern. And immediate investment, yes, that's a really good thing. And I'll be talking about that when we do a quick sort of model answer in a second. Yes, eliminating tediousness, and focusing on more direct patient care, that's really good because human to human interaction is very important, but also if we can limit the short times that doctors get to see people, we can manage the waiting times by making sure enough people are seen in a day. Yeah, storage and protection. Okay, so thank you so much everyone for sharing, and there'll be an opportunity to share another scenario in a second. So if we look at our model answer layout, let's have a look at that. So a strong answer to this scenario is one that balances optimism with caution, as you've been doing. You might say that the AI could speed up and improve fairness in how referrals are prioritized, like you've been saying, by removing the human fatigue or unconscious errors. But you'd also have to highlight that decisions about patient care should always have human oversight, especially in complex or borderline cases, like you were talking about the rare treatments, so the AI doesn't make massive generalizations. You should also mention that such systems must be transparent and well audited, and that hospital would have to be aware of the potential for AI increasing data breaches. Whether it actually would, we don't know, but having that mindset of, what could it do is very important. So well done, because I've seen you do that in the chat. Similarly, I think one of you mentioned the cost benefit analysis, which is really important because that's recognition of your role as a clinical finance manager on the hospital team. So some recognition of cost benefit analysis is highly appropriate in this scenario and something the interviewer will be looking for. Giving a balanced argument obviously goes without saying, acknowledging both the benefits and the risks, because you'll probably have about 5 minutes to talk about this in your MMI. So trying to dedicate a certain amount of time to each side so that you can talk about both sides is really important. Because you don't want to just state bullet points and black and white thinking. You want to really be able to develop your ideas to a certain level that the interviewer can see that you've got that communication skill. When you mentioned what would you mean by in relation to AI? Do you mind maybe elaborating on that question a bit? Maybe turn your mic on because I'm not sure I quite understand what you're saying. But I'll keep an eye on that. Maybe I'll come back to that question at the end if you can possibly elaborate a bit more. And in the meantime, we can move on to a second MMI scenario, which is a bit of the other side. So a patient's cancer diagnosis was delayed because an AI flagged it as low risk. What issues arise here, and how might you, as a consultant oncologist, so a cancer doctor, how might you explain this to the patient? Again, get active in that chat. If anyone wants to turn their microphone on, that would be really good. And meanwhile, I can answer this. So you don't have to give an overall opinion on yes or no, unless the interviewer might encourage it. They might say, so if you were in this scenario, would you sign this away for a certain amount of money? And they'll state that amount of money. But you don't ever usually have to give a definitive opinion. They're more interested in your reasoning than your final decision that you come to. Yeah, there's Taha. I hope I'm pronouncing your name correctly. There's certainly potential for bias.
Mariella, so sorry to interrupt. Sorry if I pronounce this wrong. I think Shadima has raised their hand.
Oh, okay, perfect. I love to hear from you. So turn your microphone on.
Can you hear me?
Yeah.
Okay. Um, I would say that issues that could arise would, I guess the obvious issue would be that the patient's like treatment will be delayed and that would kind of negatively affect their quality of life. So as the consultant oncologist, if I were to explain that to the patient, I would be very open and honest about the error that happened. And going forward, I would try and understand what caused the error and use that to improve, I guess, the AI identification in the future. That's what I would say.
That's really good. Yeah, that's exactly what I was looking for. So being honest, not lying, because you've got to be as honest as possible despite the shortcoming that the AI has led to in this clinical scenario. And let's have a look at what everyone's saying in the chat as well. If anyone wants to turn their mic on in the meantime and give another idea, feel free. Yeah, I think gently explaining the scenario, because obviously this patient's at a very vulnerable place where they've just found out this diagnosis, and the delay in their treatment will be very frustrating, perhaps for them. I think making sure you spend the time and dedicate that to ensuring they're okay with what's going on and their future treatment is really important. Issue is that, yeah, definitely. So the AI definitely has a model that like a fault in the model that needs to be addressed here, because obviously it's flagged a higher risk cancer or something that needs clinical attention as low risk and probably delayed that treatment. So yeah, thank you everyone for your inputs. And Oh, let's see. Yes, okay, I was looking for this. Accountability and responsibility is really good. And keeping a continual eye and making sure things are monitored and aren't left to the AI to just do by itself is really, really good. These are some really good ideas. I'm really impressed. Um, oh, does someone else just raise their hand now who wants to speak? Feel free to turn your mic on. Like, I don't mind if you accidentally interrupt, that's okay.
It might have been an accidental one though. I did see a hand flash. So if anybody did want to unmute and have a go, that'd be really good. And if not, we'll just move on.
That's okay. If nobody did, that's okay. Would this be classed as the doctor's mistake? If so, does the duty of candor apply to this situation? Well, I think it's very difficult. Again, this is like a grey area a bit because obviously the AI is what has flagged this as low risk, although the clinician clearly has some responsibility in terms of making sure that this doesn't happen again and that cases are monitored. There should never be a situation where an AI is purely left by itself to classify things or to say something's high risk or low risk, because genuinely it's really hard for an algorithm to, as we discussed in the last case, do stuff by itself because of the generalizations it's trained basically to make. Because if you remember my initial definition of AI is something that's like it's pattern recognition. So if it sees something 99% of the time from a scan, this thing might not be very remarkable, but it's that 1% of time where the AI will say it's unremarkable, but it needs further investigation, that's when an issue arises. So I think it's really difficult to say, but I think overall there would be some blame to be put on the clinical team rather than just saying, oh, it was the AI, because the AI isn't a person, it can't think for itself, and it needs an overview of judgment. Yeah, I think as a team, like a multidisciplinary team, it's really important for everyone to sit down and discuss how can we ensure this doesn't happen again. Prevention of future incidents reports are really important for healthcare teams to do. And that works at eliminating such things from happening again. That's really good. So if we look at our sort of model answer, there's kind of two main questions here, really. And this could be framed as an ethical question or a scenario station where you are talking to the patient. So there's lots of different ways this could crop up, but here are some things that you should and shouldn't do. So first of all, the first question is kind of like, what issues arise here? And the second question is, how would you explain this to the patient? And whether you structure this in a different way, that's okay. But the way I would structure it, you should first really explain the issues that crop up in such a situation, like you mentioned, the accountability and clinician responsibility, patient safety, and how you go about explaining this to the patient. So I really like the idea of sitting down with the patient privately in a gentle scenario, making sure they're fully understanding of what's gone on here. Since your role is the consultant oncologist, I'm glad that you've all recognised that responsibility does fall to yourself to calm this patient and tell them what has happened. And you've got to stay empathetic, again, like lots of you are saying, and do apologise, because whilst it wasn't necessarily your job to, control this AI, you are a clinician who has missed a certain thing in someone's healthcare, and the AI is not going to apologise for you, and this patient is owed an apology. So again, like you said, explaining clearly and honestly what has happened before reassuring the patient that further steps will be taken to ensure their diagnosis isn't left untreated for any longer. It's really, really important. One thing that you definitely shouldn't do in your MMI is make huge sweeping statements such as, oh, this is why AI shouldn't be trusted, or this has never happened before, because obviously these are wrong, and an interviewer won't like to see you demonizing something that will be used in the future of healthcare in the job that you will be working in. So when speaking to the patient, stick to a logical, truthful, honest, and empathetic explanation that acknowledges clinician responsibility whilst making sure the patient understands that you as a clinician are part of a multidisciplinary team, and it's a combination of time and effort and resource that has led into this mistake, but you've got to make out what will happen in future. So really looking to the future care of this patient is very important in managing their case going forwards. So yeah, thank you for all the participation there. And we're going to quickly now, whether you want to brainstorm this, just have a think, because we're not going to be able to go through all of these right now, though if you want me to revisit any of them later on, I'd be more than happy to do so, and I'd love to discuss some of these if we've got time at the end. So some further scenarios to consider. So a worried patient asks you, who in this situation is their GP, will doctors even be needed if AI is taking over medicine? And the question here is, how would you explain the role of AI to reassure them? And then, should AI be used to tell expectant parents that their baby may have a disability? An AI predicts that an elderly patient has only months left to live and recommends palliative care. The patient and family want to continue aggressive treatment. How should the healthcare team respond? How would you, as a junior doctor, respond if a patient didn't trust an AI-determined diagnosis, despite, the clinical team having reviewed that? In 20 years' time, how do you think AI will have changed the role of a doctor in the NHS? What skills might be more or less important? For each of these scenarios, remember that the interviewer, as mentioned earlier, isn't necessarily looking for a right or a wrong answer or a yes or a no definitive conclusion, but they are really interested to hear about how you apply the 4 pillars of medicine and some other characteristics of a good doctor, such as empathy and teamwork, and demonstrate a knowledge of medical ethics to tackle these tricky situations. Especially when questions around AI crop up, you need to show your knowledge, as you might have learned today, you might have already had a combination of that. Explain your understanding of AI as a supportive tool, not something that will take over the NHS. For example, with the situation involving the worried patient, the interviewer really, what they're asking in the situation is, what do you understand to be the use of AI in healthcare? Whilst showing your empathy for the worry that this patient is feeling, and talking them through about what they might be feeling and how AI isn't going to block out the use of doctors in future. It's also good to consider future implications, which is something that interviewers will be very interested in hearing your opinions on, because that will be the model of the NHS that you will be working in as a medic going into medicine at this time. So in that question about in 20 years' time, you could say, well, one skill that might be more important would be the skill of empathy, because we can't trust an AI to necessarily make empathetic judgments about how a patient might feel regarding their care. Because, for example, like I mentioned in palliative care, if we talk about respecting a patient's wishes, the AI would be trained to look at what's best for the patient in terms of, medications to manage pain. But it might be that this goes against the patient's religious or moral beliefs. So we've got to really, as doctors, be that blocker there to say, well, this is what the AI says would be best, but speaking to this patient, I can see that what they want and their wishes that must be respected is really important. So, saying we can't force a patient to do a certain path, which, as we can see, also links into the patient and family wanting to continue aggressive treatment. We've got to, if they have capacity, respect a patient's wishes. But then again, you could say a skill that might become less important would be a doctor's ability to summarize long patient histories when they get them through whatever medical web they're using, because the AI could do this for them. either way, you've got to make very clear that all skills are still very important, and AI will not eradicate the need for doctors to demonstrate skills such as teamwork and empathy and a knowledge of their profession. It's not going to make your lives that much easier from a clinical standpoint. So yeah, I really think that's been very good to look at with you. And to wrap up, I think we've seen how AI helps across every stage of life and across the NHS's system. It's here to support, but not replace clinicians, and that's what they really want you to express in your MMIs. If you can articulate eloquently as you have done today, and I really enjoyed the verbal feedback that I got there. If you can articulate like that in your interviews, you'll show you're engaged, forward-thinking, and grounded in current healthcare. AI isn't a cure-all, but it can make a huge difference when used wisely. Prevention, precision medication, and personalized care all become so much more easy, and that's really what they want to hear from you. They don't expect you to know the way that AI is programmed. They just want to know that you are aware of its role in healthcare. So thank you so much for listening. And I'd now love to hear if you have any further questions or comments, whether it's about the AI, the NHS, or MMIs, or even your UCAT. Now is the time. If you're keen to dive deeper, there's some extra reading that I've got on screen right there. And I'd also like to make you all aware that I will be working with the MyUCAT team to help with UCAT prep and interviews. So if you're thinking of giving that a go, it's a really great option. I would definitely recommend. So thank you so much for your attention today, and best of luck with your medicine applications.
Amazing. Thank you so much, Mariella. So I'm sure everyone found that super, super useful. So just kind of going forward from what Mariella said about our services in terms of the interview program. So lots and lots of help available from MyUCAT with interviews. Thinking about our interview program, which actually had a 99% success rate last year. So I'm sure everyone is thinking, like, where do I find information? Like, where do I prepare for my interviews? How do I find out what topics can be tested and how to kind of compile those into answers? So all of that will actually be covered in our interview program, which is going to be launching very, very shortly. So important to keep an eye out on our Instagram for any updates on the interview program launch, and that is going to be through October to January. Amazing insight into all different topics, and you'll all be allocated into little small groups of 5 to 6 with a top mentor specific to university choices. So, for example, I'm sure Mariella will be taking potentially an Oxford group. I'll probably be taking an Imperial group. And like us, there are so many other mentors who are at these top universities, literally every single medical school in the country, and you'll be allocated to one so they can help you tailor your preparation to the questions that they ask at that particular interview. And that is super useful to get those really personalized kind of feedback on your interview answers, lots of opportunity for practice. Some people have actually gone outside of their kind of allocated little group sessions and actually taken it upon themselves, taken the initiative to practice together as a small group, even outside of sessions with their mentor. So really important to kind of seize this opportunity and really maximize this practice you can get in such a supportive, helpful environment. Chat with our small groups is always open for any questions. So if you have any questions about interviews, if you are unsure about any topics, different angles you can take on a certain perspective, all of that help will be available on your small group chats, as well as the main group, which is going to have so many useful resources shared, so many amazing sessions covering every single topic. And as it says, you're going to go from 0 to expert. And then additionally, we have interview one-to-ones. So that is going to be university specific, high quality personalized sessions with our amazing tutors again. So that is going to be, say, if you have a UCL, King's, Manchester, Birmingham, any interview coming up, what you can do is actually book one of these interview one-to-one sessions, and that way you are going to be able to have a mock interview, very specific, very tailored to the interview you're about to have. So that is going to be super useful, kind of preparing you for the process, preparing you for the questions, and making sure anything sort of, even to the way that you present yourself on camera, if it's an online interview, all of that can be ironed out with your tutor. So I can see, I think there are a few questions in the chat. So let me just take a look, Mariella, as well, if you're happy to answer a few questions.
Yeah, definitely.
Okay, let's take a look. There will be a recording on YouTube for everyone that is asking. I think Sabina asked, how do you think AI would be implemented into the NHS and how do you think it would be managed? So Mariella, if you would like to take that question and maybe expand a little bit on that, quite a broad one,
Yeah,
but definitely maybe highlighting some points that you didn't cover
yeah.
in your topic.
So for an optimal way, like I mentioned, we've got to look at a collaboration between both humans and our existing healthcare team and AI. And I think to get that implemented into the NHS in the best case scenario possible, it will take some time and it will be really difficult. I think at a certain point, you've got to look at the system and review it every so often and see, you know, are things working? Are things not working? I think at the moment, I know that in Australia, they're certainly looking at things, for example, using AI to interpret breast cancer scans. And I think that's been very accurate so far. So certain things like this, maybe if we take indications from other countries and look at their technologies and then see how we can implement them into our healthcare system, if that's a cost-effective step to take, I think that would be very good. And how do I think this would be managed? I think there's certainly going to be new jobs that arise out of this. I think there would certainly be lots more jobs that are involved in integrating AI and educating healthcare professionals who are currently in the system on how to best use it as a clinical tool. So I think that's a really good question, and I hope that's answered it a little bit for you. Um,
Um, Is cost the most limiting factor for widespread integration of AI in the NHS? So Mario has covered so many of the kind of pros and cons of implementing the AI. And I think in terms of the most limiting, it kind of depends on which perspective you take. Like if you're considering from a ethical perspective, then thinking about things like bias, thinking about things like kind of people accepting the fact that AI is going to play such a pivotal role in their lives, especially the older generation who might actually be in hospital a lot more, might then feel a little bit uncomfortable with the concept of getting used to technology being so integral to their care. Therefore, in that kind of angle, maybe people's reception of AI and people's kind of comfort level with having it so fundamentally ingrained into their care would potentially be a greater hurdle. But then, yeah, again, as Marielle's mentioned, so many other reasons that can also limit integration that would also be taking into consideration things like the way that the NHS is split up. So maybe not all hospitals, not all foundation trusts, they might not be able to progress at the same rate. And therefore, there might be disparities. Again, thinking about healthcare inequalities, we actually have a talk coming up on that very, very soon. So keep an eye on our Instagram for that. And thinking about how healthcare inequalities might then be exacerbated by some hospitals having really, really amazing levels of integration with AI and therefore having much higher levels of care, high levels of automation, doctors much more free and available to kind of deal with things in a more patient-centered way. Whereas then you have the hospitals that might not be able to have such, advanced access to AI, they might struggle with integrating that a lot more, and therefore they would then fall behind, then deepening that divide between the rich and the poor in terms of healthcare access. So definitely lots of different angles to think about there, and you can definitely integrate those with a lot of other topics that you might be thinking about with interview. Like I've just spoken about the aging population, healthcare inequalities, and again, cost is a pivotal one, but not the only one. So, any other questions? Mariella, would you like to take the one from Becky thinking about assuming AI will be greatly implemented into the healthcare system in the future, will it be likely that AI will begin to play a role in providing guidance in invasive surgery or high-risk operations?
Yeah, I think that's a really fascinating question to think about. And I think I touched slightly on this earlier when I talked about how it could be used to train up surgeons. And I think there are certain things where you can use AI to create a surgical simulation of a patient with, some 1 in a million issues. For example, I know they've used it to model conjoined twins before, which is obviously high risk surgery, definitely. So in terms of separating these two life forms and keeping them both alive, as was the goal of the surgery, AI was very useful in surgeons before that surgery being able to learn how to do that when it didn't have someone's life involved. So I think it can certainly be implemented in situations like that, because also there are very few surgeons worldwide who know how to do conjoined twin surgery. So by using the AI, we can train so many more, which is just fabulous. And yeah, I think also something that AI could do with these surgical simulations that's really positive is it can mean that surgeons from all across the world can collaborate. So, for example, if there's an expert in America, they don't have to travel to the UK to teach us how to do a surgery. They can pitch in from abroad with this AI and projections and things. And I think that's a really fascinating potential future use of it. So I think it will increasingly be integrated into these high risk surgeries, definitely. Thank you for your question.
Amazing answer. So I think I saw another one about if AI is in use right now. And I just want to give you guys an example of how you can potentially start to integrate your university specific situations into the way that you answer this question. So say if they ask you a question about AI at maybe a more research-based university like Imperial, UCL, Oxford, Cambridge. I know that in my Imperial interview, I actually had seen in my work experience an example of where AI was being implemented in the hospital setting, where basically AI was able to analyze the cardiac MRIs and then give an assessment of potentially what it thinks it might be, so like a differential diagnosis. Obviously, it's not going to be 100% accurate. The AI doesn't know the patient's history, the patient's lifestyle, what the patient's presenting with. It's just the scan, right? But it's kind of like the building, kind of the foundation baby steps into thinking about how it can be implemented more widely. And the point is that this was actually an Imperial bit of technology, something developed at Imperial. Therefore, I then spoke about it in my interview in the context of thinking about research that Imperial has produced and how it's being implemented in hospital settings. So especially with kind of thinking about trying to introduce research from your university, but in the context of either work experience, of how it's improving patient care, that's all really important because there's no point throwing out a journal into your interview when it has no significance and how you can link it in. So really important to think about how you can maybe tie it into an aspect of patient care or something that you saw on your work experience that would be really, you know, engaging for the interview to then follow along how you then potentially did some more research into that topic. So that is basically an example of how it's being used right now, and also another example of how you can tie it in to your interview answers, especially for those more research heavy universities. So another question, I think Ojas has mentioned it a little bit, but about, I think one of the questions that was on your slides. So it says about if AI should be used to tell expectant parents about their child potentially being born with an illness. So what would be your thoughts on AI delivering this news? What do you think, Mariella?
So yeah, I think it's a very nuanced and difficult situation. I think whilst the AI could be used to determine whether a child does have this illness or not, I think that might be a better use of the AI, because when delivering and breaking bad news, I think that human to human connection can be really important for some people. And I think as a clinician, you'll be more trusted than an AI to actually deliver this news to someone. I think there is a situation in which, a patient might express, oh, I just can't talk to someone about this. I need to be given the news in a logical, structured way that the AI could actually be good at delivering this news. But I think it really depends on a case-to-case basis and what a patient and their family would find best in that circumstance. But thank you for asking.
Amazing. So sorry to put you on the spot like that, Mariella. But to add on to that, thinking about how AI can actually be used in the sense that if you take away that kind of repetitive tasks, a lot of things that AI can actually do, like looking at scans, looking at data, all of that AI can do pretty well. And therefore, the doctor's time is then better spent thinking about improving patient care, spending more time talking to them, and therefore you're then learning more about the patient's story and learning more about what is important to them. The treatment plan is more tailored to them. They're having more of a say in terms of the way that the treatment plan is structured, and as a result the patient has better outcomes, they're happier, satisfaction, quality of care all goes up. So as opposed to trying to involve AI in the more patient-centered parts where it's kind of about the connection, as Mariella said, it's better used in kind of automating a lot of the tasks, a lot of the admin that NHS staff currently have to spend quite a lot of time doing. So really important to think about how you want to improve patient care as a whole by improving the outcomes on the admin side of things and kind of speeding that up with AI, improving accuracy there, but then at the same time, committing more time as a clinician to your patients to understand their story, to understand what they kind of see going wrong with their bodies, because obviously they know their bodies best. So important to prioritize autonomy, important to prioritize forming that connection, expressing empathy, all of those buzzwords that I'm sure you'll be coming across in the next few weeks and months. Any other questions? Lots of strategic application questions. But I think really important to have a look at our guide as well. If you have any further questions about strategic applications, a lot of that will be mentioned there. I think we actually have a raised hand. So if you would like to unmute and maybe Mariella could take this question.
Hi, can you hear me all right?
Yeah, perfect. Thank you.
Would you mind elaborating on how AI can lead to discrimination, specifically with gender and race, and if there are any examples of if that's happened before?
Yeah, so I think there's certainly been examples where it's happened before, which is more to do with personalized medicine and why, analyzing people's genomes is very important. But in certain areas, if there's a significant population of a certain race or a certain gender and a certain condition linked to that, then the people who don't necessarily fit that more common brief get kind of thrown under the rug or swept away. And I think there are specific examples, certainly. I'd have to do a bit more research into that to give you specific times when it's happened. But I know there's certainly times when AI has been shamed as being too generalizationary and not taking into account the case by case basis as much. I'm not sure if Aishita has anything to add to that.
So yeah, again, I would have to have a look at the specifics in terms of an actual case study or example of maybe where it has been used in an unfair way, but just thinking about the data sets that the AI is kind of learning off of. As Maria said, if it's biased towards or against a certain category of people, then that would mean that they get sidelined. And I think this might answer another question, but I remember hearing about this particular case where, in terms of like chat bot sort of situations, they actually did create this one. And I think it was called Babylon Health, if I remember correctly. But basically, I think it did definitely have quite a few issues. So if you look into that particular one, that might be a good one to think about. And on that same note, I think Queen Mary, they often give you a little article to kind of read and they ask questions about that in their interview. So they give you the article, I think a couple weeks before, and then you get asked the questions. So having a think about some of these current affairs topics is really important to make sure that you're able to analyze the article and prepare for any questions on that properly. So really important to consider attending these sessions, making sure you're aware of all these different topics and different nuanced perspectives you can take on those, which is really, really good. So I think that is probably the last question we can take. So on that note, thank you so much, everybody, for attending. It's been so lovely seeing all of your thoughts, answers, and contributions. And I'm sure Marilla will agree, having this kind of space to voice your opinions, get some ideas thrown around is really, really productive for your interview preparations. You can see other people's ideas and you can see kind of ways that people are approaching the situation in a sense that you might not have thought about before. So that's why it's super important to gain different perspectives, different thoughts and ideas on these topics. And for that, as I just mentioned, interview program amazing, as well as these free sessions that we will continue to run for the next few weeks. So I think there's a question on dentistry interview preparation. As I said, yes. So amazing. And the recording will be available on YouTube. So thank you so much, guys, for attending. It was lovely speaking to you all. And thank you so much, Mariella. That was such an amazing, informative session. So many different things covered there. Brilliant. So we will see you guys all on Sunday, hopefully again for another session. And this time it's on prions, so a bit more sciencey, but again, super, super useful for those people thinking about Oxbridge interviews where they might ask you about a nuanced scientific topic like that. So amazing. Thank you so much for attending, guys. So yeah, we have prions on Sunday and then I think vaccines, if I remember correctly, the Wednesday after. So amazing. Thank you so much for attending, and we'll see you on Sunday. Bye.
Thank you, everyone.
Bye.